Hello, everybody. Thank you for having us. My name is Dr. Mark Anderson, and I, along with Dr. Rose Sivilli and Dr. Ross Francis, co-authored this QI project titled Adverse Drug Reaction Documentation on the Inpatient Psychiatric Unit and Provider Perception on Patient Care. The purpose of this quality improvement project was to obtain the opinions of inpatient psychiatric physicians and psychiatric residents on improper and incomplete documentation of medication allergies and their impact on patient care to determine the prevalence of improperly documented allergies to relevant medications in patients on the inpatient psychiatric unit at our institution. To provide some background on this QI project and the topic, a fairly exhaustive literature search shows that vague, incomplete, or inaccurate drug allergy histories can be detrimental to patient safety and affect patient care. There is an increased chance of medication errors and negative outcomes if details of a drug allergy are not properly documented. Incomplete or inaccurate allergy histories may result in delayed administration of emergent medications, as well as increased time spent by healthcare providers to clarify an order in question. Among other potential problems, in a psychiatric inpatient unit, there may be times when a medication is needed emergently to control violence or aggression in psychosis and maintain the safety of the patient and others on the unit. This QA project was done in 2 parts and completed using a voluntary qualitative survey, data collected from inpatient psychiatric physicians and residents, 40 in total, that had treated patients on the inpatient psychiatric units on or after January of 2020, on improper documentation of psychiatric medications and its perceived effects of patient care. Using survey data to develop inclusion criteria, we performed an unidentified retrospective chart review of 552 patients who were both voluntarily and involuntarily admitted to any of our institution's inpatient psychiatric units in the 3-month period between August 1st and October 31st, 2020. This slide just illustrates the 5 questions that we used in our voluntary qualitative survey, and all of our questions will be discussed further in upcoming slides. Here we see that 72.5%, or 29 of 40 people surveyed, thought that the current system for documenting allergies has negatively affected their ability to provide patient care on the inpatient psychiatric unit. So this question looked at how care was affected, and as we can see here, a vast majority of those thought that their confidence in giving agitation and psychosis medications in an emergent situation and or having to override a documented allergy which was felt to be inaccurate were predominant problems. There were other things listed and those are on the side, but the 2 major ones were the ones I just referred to. In this question, we see how often providers saw listed allergies to psychotropic medications that are either incorrect or not properly documented. And we see that 9 of 40 are often, 26 of 40 say sometimes, and 5 of 40 say rarely. And I think it's important to notice that nobody said that they've never seen it. This question asked providers which medications they felt are most problematic regarding improperly documented allergies. And as we can see, over 50% said that antipsychotics were the most problematic, followed far behind by mood stabilizers, anxiolytics, and then other things like sleep medicine and antidepressants. This question is actually where we came up with our inclusion criteria of using only antipsychotics for our chart review. We felt that this question, asking those surveyed if they know how to access patient allergies in Cerner to review, make changes to, and or list new medication allergies, to be particularly interesting, because as you can see, 50% did say yes, but 17 out of 40 said maybe, but more training would be helpful, And 3 of 40, almost 8%, said that they did not, which, given that these are providers and resident providers, is potentially problematic. For our retrospective chart review, data on allergic reactions to any antipsychotic medication documented in the electronic medical record was recorded and analyzed to determine the medications, the specific reactions, the severity of reactions, and whether it was a suspected true allergic reaction or a suspected side effect, based on the definitions in slide 11 below. The documented reactions were then categorized into 3 color-coded categories: complete and properly documented suspected true allergic reactions, complete and properly documented suspected side effects, and improper and or incompletely documented reactions to any medication. The proportion of these categories compared to the number of patients with the documented antipsychotic allergies were then calculated. So what do we mean by allergy versus side effect? Well, for the purposes of our study, a true allergy would be defined as reported symptoms consistent with an immunological drug allergy, including but not limited to anaphylaxis, hives, itching, shortness of breath, swelling, rash, or other skin reactions, or any other serious reaction where the medication would probably not be used again by the physician or other provider. A side effect would be symptoms that are not consistent with an immunological drug allergy, including but not limited to nausea, vomiting, diarrhea, headache, drowsiness, weakness, agitation, or any other reaction where the drug may be used again at the discretion of the provider. The retrospective chart review illustrates that a significant number of the patients in our sample population, 241 of the 552, had documented allergies to medications. Of those, 68 had a documented allergy to an antipsychotic in the EMR. Of the 68 patients with a documented antipsychotic allergy, 41 had documentation that was either incorrect and or incomplete. Of the 27 completely and correctly documented, only 18 had allergies that fit criteria for a true allergy as defined above, with the other 9 meeting criteria for side effect. Consistent with survey data, there are a substantial number of improperly and or incompletely documented allergies to antipsychotics listed in the patient charts that may contribute to poor patient outcomes and increased difficulty in patient treatment on the inpatient psychiatric units. Though chart review analysis was limited to antipsychotic allergy documentation, the significant amount of documented non-antipsychotic patient allergies in our sample population would suggest that the prevalence of incorrect and or incomplete allergy documentation is significantly greater. The survey shows that a significant portion of respondents reported that it had negatively impacted patient care. Additionally, nearly half of respondents felt that more training on the documentation of allergies in the EMR would be helpful. Given the results of this product, there appears to be a need for improvements to the current system of documenting allergies at our institution. Subsequently, future interventions may include, but are not limited to, further research to determine the prevalence of documented adverse outcomes in patients because of improperly or incompletely documented allergies, development and implementation of added training in the review and documentation of medication allergies, and implementation of a standardized system of obtaining and documenting allergies. Here are the 2 references that were cited earlier in our presentation, and we'd like to give a big special thanks to Dr. Nina Vadiei, our psychopharmacist, Dr. Michael Colon, one of our inpatient attendings and QI supervisor, and Brad McKinney, who assisted in a lot of data gathering for this project. Thank you and have a great day.